So, good morning, I guess afternoon here on the East Coast to everyone. Hello, how is everybody today?
Oh, everything's great.
Good,
Nice to
good.
see you. And,
Fantastic. So,
Torie.
we are live. We are live in the private Facebook group for mild cognitive impairment. And I want to thank you for joining me today, my guests, and also the people who are watching live on Facebook. My guests are Dr. Jeffrey Apter, Medical Director of the Princeton Medical Institute, and Torie Pendleton, Program Manager for Activate Your Brain at the Global Alzheimer's Platform Foundation. Torie is a member of this group too, so thank you for helping me set this up, and thank you for being here today. Torie, by coincidence this morning, I was speaking to a researcher here in New Jersey who happened to be with you in Nashville last week for the GAP meeting. And I think she was just energized and even blown away by all the researchers she met, all that she learned, all that's going on. And it's an exciting time. You know, I know that people here in the group see articles about encouraging research. They post them here. People love to see it because it gives them hope. It gives them encouragement. I know that part of what we want to talk about today is how to keep that research going faster and to get those treatments and get them sooner and get them to people. And that's part of what we want to talk about today, but also things that people can do right now that are proven by science to promote brain health and help protect their cognition right now. So let's start with the present, the site Activate Your Brain. I spend a lot of time on it. It's fantastic. And it's got great information. Tell people a little bit about what they can do to take advantage of these healthy behaviors.
So one of the really great things, and I do appreciate, I know that you were talking to Michelle today. She and I have been corresponding back and forth, and she is very excited, and I look forward to working with her. One of the great things about the Global Alzheimer's Platform Foundation is we have a mandate of finding a cure for Alzheimer's by 2020. And we are very fortunate because we have relationships with people like researchers and doctors like Dr. Apter, because these are the best researchers in the country and in Canada. We also have sites in Canada. So through Activate Your Brain, what we did at GAP was we developed a brain health initiative that talks about brain health pillars. We talk about eating well, staying active. We talk about getting enough sleep, exercising your brain, connecting with friends and families, relaxing and reducing stress, controlling our risk factors. But our eighth pillar, what makes us a little bit different, is we also talk about getting involved in research, because we are not going to find a cure for Alzheimer's, mild cognitive impairment, or these cognitive diseases that affect so many of us. We're not going to find a cure unless we can get people to participate. So through Activate Your Brain, I'm able to do a little bit of education. I go to different corporations, different community groups. A lot of our researchers and principal investigators, their organizations use Activate Your Brain. And one of the nice things is on a national level, when I go out and I actually talk about Activate Your Brain and give just really practical, everyday ideas of what it is that you can do to maintain brain health, I actually have the ability to then point people to people like Dr. Apter in Princeton and Michelle that we were talking about also in New Jersey, because these organizations also quite often they offer free memory screenings. They offer a lot of support that people just do not know that's out there. So that's what's the really nice thing about Activate Your Brain, and being able to, I'm able to help people on the front end live healthier lives, make some decisions, make good choices, but then I actually have that second opportunity to lead them in a direction where they can actually get help.
Yeah, that's fantastic. And third, when you do go and you talk to people about these things, a couple things I'm curious about. One, there just seems to be so many myths and so much misinformation. And do you see some, and do you help people dispel them? And then just talk a little bit about, if people embrace these things, what the benefits can be.
Well, I absolutely do. That is one of the reasons that I absolutely wanted to be part of Activate Your Brain. I have a very long career in long-term care, assisted living, adult day, just in that population in general. And when I'm on the Facebook or I'm on social media and, for example, I hear chocolate is good for you. Well, yes. However, the evidence doesn't mean that we get to eat a Snickers bar and a Milky Way 4 or 5 times a day. What that's talking about is coca, 73% or above, pure, no hydrogenated oil, without all the sugar. That actually has been shown to have effect on cognition and inflammation. So I get to clear up some of those myths and some of those ideas whenever we get these really strange questions. So that's the absolute best part of that. I actually forgot the second part of the question. Isn't that relevant?
No, just some of the benefits. And just real quickly, it's interesting you mentioned that the chocolates, because the brain healthy ingredient in true dark chocolate is flavanols, and I actually had a chance to participate in a clinical trial at Columbia University on flavanols. And so I took, and people gave me a bad time. Oh, you're willing to eat chocolate for science, good for you. And it just turned out to be a tasteless pill. I was really disappointed. But that's an example of something that's being tested right now, actually as medicine. For cognitive impairment and cognitive decline. So just talk a little bit about what some of these benefits can be.
So, large studies talk about the benefit of dietary interventions, particularly those foods and beverages that have those flavonoids in them. We talk about how they help with vascular function and can improve memory and learning. And I'm going to defer to the real science of it to Dr. Apter so that he can really tell us exactly. He's the expert on some of those things.
Yeah, please join in.
Well, we've been working in mild cognitive impairment since the 80s, and at Princeton Medical Institute, we did very many studies back in the 80s for mild cognitive impairment, at that time called age-associated memory impairment and prodromal Alzheimer's. And we were one of the few sites for the Aricept study and Epsilon studies. So at our site, every drug that's been approved for Alzheimer's has been through Princeton Medical Institute. So we've been at the forefront of this for a long time. So we do offer free memory screening for anybody who calls here. And this is available to anybody. You don't have to participate in a research study. But as Torie said, one of our pillars of health, we find that people who are involved in research, it does activate your brain. It does give you a reason to get involved, to keep your brain active. I gave a talk yesterday in Monroe, New Jersey, to a group of people. And the first thing they said is, if you don't use it, you lose it. Mm-hmm. I had a 101-year-old lady in the audience who remembered 3 difficult words, and she was actually the first one to put up her hand. So there is something to active cognitive involvement, being involved in your community, flavonoids, healthy diet. We talk a lot about the Mediterranean diet. People living on the Mediterranean live longer because they're eating a healthier diet. The fish oils, the nuts, the fish. There's a group of people who came from an island in Greece where they have a lot of cognitive involvement. They involved in the community. They walk every day to get fresh fruit and vegetables, greet their neighbors, become very involved in their community. But when some people from this community moved to Chicago and became socially isolated, their risks of developing mild cognitive impairment became the same as Americans. So there is something, living on an island, low stress levels, a lot of fish oils, nuts, And also, they're very involved in the community. People don't sit home and watch TV there. They walk to get their supplies every day. They don't stock up, they don't get Amazon delivery. So it's very, very important is this active cognitive involvement, leisure activities, keeping your brain active, and they activate your brain. And we were one of the few original sites in the global Alzheimer platform. We were very much involved in helping with development of this, and welcome that Torie's come on board and kind of really going to launch this with a new video, which we're very excited about to put on our website. So if anybody's interested in free memory screening, they can certainly use Princeton Medical Institute as a resource. Our website is www.princetonmedicalinstitute.com. The phone number here is 609-921-6050. So people can feel free to contact us. They can use us just as a resource. They don't have to participate in a clinical trial. And every day of the week, we offer free memory screening. There are many nutrients that can be useful. In India, they may have a lower risk of Alzheimer's because they take a lot of anti-inflammatories, humans, turmeric. These are all things, maybe there's something in red wine, kind of controversial, but people in the Burgundy area of France are actually not taking a pill, they're actually drinking the red wine.
So with the red wine, Tony, we actually inactivate your brain. I always tell everyone the MIND diet was a very good study. The MIND diet took two diets, one that was good for cardio and the Mediterranean diet, and put it together. And they actually recommend 4 ounces of wine because of the flavonoids and the resveratrol. But I always tell people, if you don't drink, don't start, because that's an issue. You can eat blueberries. Blueberries have been shown to have those same compounds. And really what we're talking about when we're discussing eating well, eating well is, I always relate it back to, it's exactly what your 5th grade health teacher told you to do. Mm-hmm. Green leafy vegetables, nuts, legumes. Don't eat a ton of fried food, because we have research that has shown that contributes to neuroinflammation. And this is an issue when it comes to cognition. We also know that there's a lot of sleep studies going on right now. And with the 3 sleep studies, we talk about sleep apnea. I always recommend that people, if they feel like there's any issue at all, get a sleep apnea test, because that lack of oxygen absolutely has an effect on your vascular system, absolutely has effect on that neurovascular system that can cause, just in the news, just the other day, right? We have Luke Perry, 52 years old, massive stroke. And so when we're talking about activate your brain, we're talking about doing those things. Staying physically active also helps with your cardiovascular health. There are a lot of, and Dr. Apter can confirm this, there are a lot of the dementias, mild cognitive impairments, the dementias, that we can actually prevent just through healthy lifestyle. I'm not saying we can prevent Alzheimer's, because we know that right at this point we don't know how to do that, but we know that we can affect change in a lot of the dementias. Dementia is an umbrella term that holds different types of cognitive decline within it. So as we progress, we know that staying active has an effect on that. Getting enough sleep. We have lots of studies that talk about, we had this most recent study last year that talked about those people who have a lot of interaction with their grandchildren actually have more social connections, so they don't develop that apathy. So we're talking about the mild cognitive impairment individuals, which is what this group is talking about. We're talking about staying social. It keeps you more active. You have to think more. It increases your mood. It increases the good feelings that we all have. So these are some just very simple lifestyle changes that we're attempting to encourage people to make, because, for example, Dr. Apter mentioned omega-3s. We're talking about omega-3s. We know that, contrary to a recent report that came out last year that really is kind of a controversial study as far as size, there's research that proves that there's a 30% decrease in the chance of cognitive decline if you have enough omega-3s within your system. So eat more fish, eat more seafood, eat more salmon, eat more yellowfin tuna, but eat quality. And we don't want to eat it fried.
Yeah.
That's the difference.
Yeah, it's interesting with the omega-3s. I saw some research recently. Not only are many people who eat the Western diet deficient, but there was a study that found that 10-15% of the people they tested had no measurable level of omega-3 in their body. Which, when you know how important that is, that's frightening. Let me jump in on two things real quick. One, Dr. Apter, you were talking about research locations and people, those of us who are in New Jersey, the Princeton Medical Institute is a fantastic resource. For the group, I did just post in the thread with this a link from the Global Alzheimer platform, all of your states, all of the states, sites in all of the states, and I encourage people to see that. And it's interesting what you were saying about sleep, because we've actually had several people in the group in the last 2 or 3 days post articles about sleep and the importance of sleep. So fortunately, people are starting to see some of this information. Let's talk a little bit, and Dr. Apter, if you would, just kind of specifically about mild cognitive impairment. You got 30 years of research in this. You know it as well as anybody. People are always wondering, does that mean I have Alzheimer's? Does that mean I'm going to develop Alzheimer's? How can I tell? And just talk about mild cognitive impairment, what it means about risk for dementia. Help explain that to people. That's always a question.
Well, mild cognitive impairment can be a prodrome of Alzheimer's disease, and that doesn't mean that it's inevitable. So there are measures you can take, and we've been talking about some of the key measures. Certainly exercise is another thing to bring up. Even 20 minutes of exercise a day, walking in the mall when we have bad weather, keeping your body active, that's very good. Keeping the brain active. There are things that you can do, like learn a new language. That's kind of really tricky on the brain. Use your left hand if you're right-handed. Go to supermarkets where you don't know where everything is, so try to challenge your brain. There are many crossword puzzles, Sudoku, some of these games like Luminosity. I think even on the Caring Connections on the website, we have some connection with the Cleveland Clinic to do some memory training. So memory training is very useful. Good diet. So, it's not an inevitable thing, and people should feel very proactive. I think that one of the best things you can do if you're diagnosed with MCI is to get involved in a research study. And we're realizing that the earlier we diagnose and the earlier we treat, the better the outcome. We're even going earlier in people who have who what we call prevention studies, people who don't even have MCI and may have some risk factors. And we're studying some of the medications that we're involved with in prevention of MCI and prevention of Alzheimer's disease. So there are a lot of things that you can do to take charge, a lot of things to keep your brain active. Staying working is good. Hobbies are good. These are all very good things to keep involved. Being active in your community, your religious community, those are all good things to do. And so it's not an inevitable thing. And ensuring good sleep. One of the drug companies we're working on a pro-melatonin drug that helps restore normal sleep. And it's thought that this medication may, and the study is still underway, so we don't know the results yet, but may reset the sleep cycle and may help improve memory. But certainly you could if you're having trouble sleeping, try some natural things like melatonin. We know that exercise is good, as I mentioned, relaxation, meditation, yoga. These are all things you can do. There's a kitten meditation you can find on YouTube. If you're doing this, Dr. Singh in LA has found that this helps prevent and has actually helped some patients with MCI. So it's the Satya Nama. If you just Google Satya Nama YouTube, you can find the directions. It's actually a very easy meditation to learn. It's one of the least complicated ones. Some of them are extremely complicated with their instructions. So I recommend to all the members here just to Google Satya Nama Kitten meditation. But if you just Google on YouTube, you'll find a lot of examples. And that's a very easy meditation to learn. Relaxation, stress reduction. Stress takes a lot of power out of your brain.
Right.
Add, Tony, if I can add,
please do.
If I can add on the MCI side, when we're talking about doing all these activate your brain measures and taking care, controlling risk factors, we aren't saying that these measures are going to cure or stop. What we're saying is that it is a protective measure. You're going to create new neural pathways. You're going to create new ways for your brain to develop cognitive reserve, meaning it gives you a resilience. Mm-hmm. And so if you have MCI, Dr. Apter said that MCI couldn't be a prodromal, but it's not necessarily that you're going to end up with Alzheimer's. The idea is if you participate in activate your brain health type of measures, you're going to be able to stave off the development of these types of dementias for a longer period of time. You're going to stay healthier longer. And that's very, very important when we're talking about the fact that we're all aging, we're all living longer. We're starting to see higher age incidences of Alzheimer's being diagnosed much later in life. So we have a long time. All of us have a long time to live. It's time for us to start taking care of us and our own selves, and that's how activate your brain and the brain health measures can fit into that.
Yeah, absolutely. So Dr. Apter, what are you learning from your research about mild cognitive impairment? You mentioned it, and this is kind of what I've seen. I mean, the focus of research is really shifting toward people with mild cognitive impairment, with the idea that getting people sooner is going to be more effective. But what are you seeing in your research? What are you trying to learn? And what are the challenges? What are the challenges with research right now?
Well, the challenges is we haven't found a cure, and as Torie said, the goal of the global Alzheimer platform is to get a drug approved by 2025. And if the drug is not currently in research, it has no chance of being approved by 2025. So at Princeton Medical Institute, we have a whole array of studies that may be helpful to people because participating in the study itself is brain protective. But not only that, we need people to participate in research to find this cure. So participation in research is altruistic, but it also helps you. And may prevent progression of MCI. Also, I have a friend, Dr. Joyce Kramer at Yale, who wrote a book about clinical research. And in the book, she says the best medical care you can get in America is through participating in a clinical research study. Because where else can you see a board-certified doctor for free, get free transportation to a research site, MRIs? We also do PET scans on patients. PET scans is not covered by Medicare. It's almost a $3,000, $4,000 item. And what we do is we test the PET scan, looking at the amyloid load in the brain. And now we can actually look at the tau load in the brain. And we can do that serially to see if the amount of amyloid and tau is decreasing with time. So we're looking at biomarkers. We're looking at cognitive testing. We're looking at a lot of different things, and the science is getting very advanced. I'm very excited because I'm going to be going to the Lisbon meeting of the Alzheimer Disease Association, not the American, but it's called ADPD, Alzheimer's Parkinson's disease. It's a combined meeting, and there's a lot of the best researchers in the world will be there, because this is the best scientific meeting in the world for this kind of research, MCI and dementia research, the ADPD conference. And so there's going to be a lot of interaction there, a lot of early stuff. So I'm very excited for that meeting, as always.
Mm-hmm. And in terms of people who you are working with, who are going through clinical trials you're involved in right now, what motivates them? What gets them to commit to this and want to do this?
We actually did an exit interview, and I actually published this, and we actually surveyed all our patients who exited our clinical trials. And the number one reason is altruism. Number one reason that people do participate in clinical research. People don't come in for the stipends, really. That seems to be the least important. But there isn't a drug on the market that helps prevent progression of MCI. And so we need people to participate in the study. So they are helping themselves, and definitely they're contributing to medical science. And I think that's the major reason why people actually do participate in clinical trials. It's also good for your brain, as we said. It's good for your mind. And you get a tremendous workup. We do blood workup during the studies, we do MRIs, EKGs, and we release all these results to your medical doctor. We don't take the place of your medical doctor, but we don't mind sharing. We're very collaborative. So our research site is part of Penn Medicine, Princeton Health, and we have a lot of doctors who refer to us. Patients for studies, patients who may be interested, and the doctors themselves get learn a lot about their patients through their participation in our clinical trials. So we send them the results of the PET scans, the MRIs, the blood work, and sometimes we actually find things that are wrong with the patients medically, which is just a coincidence for them, because we do such a tremendous workup on patients.
Yeah, and I can just, from my own experience, the experience I had with the clinical trial at Columbia, I got a level of medical care for free that I don't know what it cost, but I wouldn't be surprised if I got $100,000 in medical care in terms of the various treatments, the exposure to the specialists, the physicals, just everything. It was unbelievable to be in the hands of people like that, and made me feel very good about that. Listen, some questions have come in, and I'd just like to take a few minutes to address a couple of these, put them out there. So someone asks, because we talked about omega-3s, are omega-3 supplements useful for MCI patients? What would you suggest daily milligrams I should be taking? I don't eat seafood and I don't like seafood, but my doctor has me on omega-3. What can you provide any answer for that?
Well, the main thing is a good quality omega-3. There is one that's actually a prescription, but it's quite expensive if it's not covered by your insurance. But I would say a good quality omega-3, I would go to your health food store, get a high quality one with DHEA in it. I don't think the milligrams is that important, but you can just, usually the stock bottles there that they have in the health food store, ask for a high quality one. There's even vegetarian ones if people really object to taking fish. Udo's oil is a good one. A tablespoon of that every day, a couple of times a day. That's very good, and that has no fish in it. So if people object to any kind of fish, they can take a vegetarian one like Udo's, which is a very high quality. But I would speak to your pharmacist or nutritionist or health food store about a high quality omega-3 fatty acid. And I think it's good for everybody to take. It's good for cardiac health. And the other thing we do in studies is we also do a good medical workup. So we detect things like thyroid imbalance, diabetic imbalance. So it's very important to keep your blood pressure under control, your diabetes under control, inflammatory disease under control. So these are some of the part of the workup because they are reversible forms, causes of dementia and MCI. Mm-hmm. If your thyroid is out of whack, if you're depressed, if your B12 or folate are low, that can cause depression and it can cause memory issues.
Go ahead, Terry.
If you don't necessarily like fish, you can also get a really good dose of omega-3s from walnuts, flax and chia seeds. So there are some other vegetarian type of options, and I will recommend, and I can send this to you as far as a high quality. I actually personally met. There's a brand out there called Wiley's, and it's they outsource Alaskan pollock, and it is a small little company in Ohio. So I can send you that. That is and you don't get the fish burp with their product. You do get it at a health food store, but I can tell you that. But there are some healthy vegetables and vegetarian nuts and things that you can use that you don't necessarily have to eat the fish, because that is a big complaint with a lot of people. However, when you talk about your brain and your nervous system, the tissues are partly made up of fat, and we know that DHA in particular is very important to maintain brain health, just brain health in general, the size of your brain, the function of your brain. So it is important. And for MCI, it's absolutely important.
Yeah, those are definitely words to the wise. A couple things relating to possible barriers to being involved in research. One is transportation. And Dr. Apter, you talked about that. The organization has a relationship with Lyft, right?
Yes.
So talk a little bit about that.
So anybody who's eligible for a clinical trial can get a lift with Lyft. And this has been enabled through the global Alzheimer platform. So we have a relationship. We have always paid for transportation. We've always allowed Uber and Lyft. But now we have some official relationship. One of the barriers can be not having a caregiver. So normally in a study,
it's like you can see that. Address that as well.
So yeah, you do need a study partner. It doesn't have to be a relative. It can be a neighbor, it can be a friend, it can be a paid professional it just has to be somebody who spends some time with the client, because the FDA, in order to approve a drug, wants a global assessment independent of the research site of how the patient is doing. And so this requires a reliable study partner. So this does not have to be a relative. It can be a friend, it can be a neighbor, it can be somebody from your church or synagogue, it can be somebody you're paying to take care of you. So these are all options for people to consider.
Yeah, in good options. So I did mention a little earlier, I posted a link to the GAP site, and particularly the page that lists all of the different, so people can look at their state and then find something near them. For someone who says, I just want to know a little bit more, I just kind of want to see if I might be eligible for a clinical trial, if I could participate, is there anywhere else I can direct them?
Well, actually, you can go on clinicaltrials.gov and find research sites that are currently doing interesting studies. There's a listing per study. You just put in your condition and you'll come up with a list of sites. So those are usually the best options. Talk to your local doctor about research studies, referrals. Some doctors are more likely to refer patients to studies. Mm-hmm. Other doctors are more reluctant. There's still some barriers there. But what we like to do is communicate with the doctors. So we find that's very important, that we talk to the doctor himself, that we communicate with the doctor, and that he realizes that we're not taking the patient away from him. We're actually partners with the doctor in this endeavor.
Yeah, that's very important. So I just, for the people in the group, you may have seen, I just added the link to clinicaltrials.gov. And one of our members of the group too, she was referred to a study by her neurologist and mentioned that. So that's a great example of how just talking to your doctor, your primary care doctor, your neurologist, they may be able to refer you to something that's relevant for you. That you might be eligible for. I saw the director of research for Eli Lilly quoted recently saying, if we could fill every clinical trial right now that's going on right now, we could find a cure 6 years sooner. I think it's important for people to hear things like that, just because it really underscores we could be moving a lot faster. We could get this available sooner. Both of you referred to the year 2025, so that's the U.S. national goal, is to have effective treatments by 2025. I talk to researchers who feel pretty optimistic we're going to get there by 2025, maybe sooner. They'd love to get there sooner, and they'd love to have people in their trials to help them do that.
You know, and Tony, one of the relevant things when we talk about activate your brain and we talk about controlling your risk factors, that is very relevant when it comes to being part of a research study, because while you may have a diagnosis of MCI, if you want to be part of a clinical research trial, there are very specific parameters, and there are certain comorbidities, certain disease processes that will actually disqualify you from a study. So when we're talking about living a healthy lifestyle, a brain healthy lifestyle, that actually, so if you're not necessarily interested in a clinical study now, and you may be 5 years from now, living this brain healthy life will actually up your chances of being of Dr. Apter being able to get you into one of his clinical trials. So that's important.
Yeah, that is. And I think one of the other things, and maybe we could touch upon this, and Dr. Apter, this may be more directed to you. What I really see when people get diagnosed, they first join the group, they have a few questions they always seem to ask, and one of them is, how fast am I going to progress? And, the people that have been in the group longer are a little more knowledge about this. Say, well, no one knows and it's individual. But I think the key is people having that understanding that it is possible potentially to delay it, to slow it down, to stabilize, and that it's not that unusual for someone with MCI to stabilize for a period while people like you are working furiously toward some treatments. But just talk a little bit about that, about how it progresses, about how it's individual for people, and just what people can do to try to be one of those people that progresses more slowly.
So yeah, progression is very variable, but the typical course is very gradual. It's not an abrupt decline. People decline slowly over several years. There's no recipe for that. So, I think the main thing is to be under the care of a doctor, somebody who's knowledgeable about MCI. And we have a local neurology group, Lawrenceville Neurology, who refers a lot of people to us because they realize that this is really an important option. Our hospital, Princeton Medical Center, Penn Health now Princeton Medicine, they've been very instrumental about getting us into the community. We do memory screenings almost weekly in the community. I gave a lecture yesterday, as I mentioned, in a retirement community. I have one tomorrow morning in a retirement community. So our hospital has been very proactive. So I think the main thing is to get the word out there. And, we don't want to give people a recipe. This is how long it's going to take to progress. I think everybody should be observed and watched at their own rate.
Yeah, and just while you're chatting there, I'm getting into add a link to the Princeton Medical Institute to our group, and let me do that very quickly. Can you give people an example of perhaps some of the types of studies that your institute is involved in right now, or that you're personally involved in, just to give people a feel for that?
Yeah, I've been involved, as I mentioned, in Alzheimer research for over 30 years, and we were involved in the approvals for Aricept, Namenda, Exelon. We're also very involved in and excited about the news about a new depression drug getting a pre-approval from the FDA, and we're very involved in this group of drugs. So many companies are working with ultra rapidly acting antidepressants. So we do a lot of studies in depression, ADHD, fibromyalgia, migraine. So quite a nice variety of different studies in psychiatry and neurology. And it's a pretty active area.
Yeah.
So we're pretty much involved in neuroscience research.
So this is fantastic. I do try to keep these to a reasonable amount of time. We tend to find about 40 minutes is good. So I think I'm not seeing new questions. I think we could wrap up here. I just wanted to give each of you a chance, if you'd like, for any closing thoughts, any other points that we haven't addressed today.
Well, anybody who's interested in research can give us a call. You don't even have to be local. We're happy to try to guide you and help you. You can come in for free memory testing. We offer that to anybody. There's no obligation to do a clinical trial. And I think what's very important is to go on the site, PrincetonMedicalInstitute.com, go on the Global Alzheimer Platform site. There's a lot of tips. There's a lot of knowledge to be gained, and we feel very optimistic. We're certainly very optimistic about the research that's going on, and I can't wait to see the latest in Lisbon in the end of March.
Yeah, I would love, maybe we could get you to come back on when you're back from Lisbon, and you can
Absolutely.
talk to
I'd love
the
to.
newest. I would love to do that. Torie, you were instrumental in putting this together, and you're a member of our group, and we appreciate having you in the group and what you bring. And again, just love your site and love the whole Activate Your Brain concept. Any final thoughts from you?
A couple of things. As far as finding research, to add to what Dr. Apter said, Us Against Alzheimer's is our partner organization, and they actually just created and put out a new zip code locator, which actually will also help you find clinical research within the United States and Canada. You just have to put the zip code for wherever you're looking for. The other thing is you can go on NIA, the NIA site, and actually just type in questions to ask when getting involved in a study. And there's actually a nice little list of questions. So if you want to go see Dr. Apter, give you a nice little list of the questions that you necessarily wouldn't know to ask. Very simple things like, how involved is this? What test am I going to get done? Things like that. For my side, as far as the brain health, having the experience that I have professionally, I will tell you that I have seen these brain health measures work even in people who have very advanced stages of dementia and Alzheimer's. I've worked in memory cares. We've taken these, what's called the finger study. It's a Finnish study that basically did lifestyle studies. I've seen them work. So, and then as far as being part of this group, I actually have fibromyalgia, so I suffer from brain fog. So I actually do these things. This is how I maintain my health. I am not on any meds. And as you can tell, sometimes when I speak, the words don't come out, but I'm not on meds, and that's how I live, and it's why I'm such a big proponent of what we are trying to do, what GAP is trying to do, what Activate Your Brain is involved in, and then what Dr. Apter and all of his colleagues. I will tell you that, like you said, we were in Nashville just recently. We had over 70 clinical sites there. I met some of the best people, and they're all involved in research to solve these issues. So just for the group to know that there is an entire army of people out there, both United States, Canada, and globally, trying to solve this problem for you. So you are not alone. We are there, and we're trying to make it happen.
Okay, that's a fantastic point to wrap up on. Thanks again for joining us. People who see the archive version of this, there's many links there that they can use, they can follow. Thanks again. I appreciate you joining us today. I'm gonna sign off for now, but I know we'll be in touch, and I would look forward to doing this again at some point. Both of you, thanks again. Have a great day.
Thank you for having me.
Have to do it again. Thanks, Tony.
Thank you.
Thanks.
Yep.
Bye-bye.
Bye-bye.